Hello, everyone. My name is Tejendra Ferali. I would like to welcome you to this launch event of the special issue of Education and Conflict Review. I'm based in UCL, so I'm Professor of Education, Conflict and Peace. And I am joined by a wonderful panel of speakers today who will be sharing their work, which has just been published in the Education and Conflict Review. As we know, those of us who work in the field of education, conflict, and emergencies, around 234 million school-aged children and adolescents in more than 60 conflict-affected countries are in need of urgent educational support. And the body of evidence that exists in relation to supporting education for these children has been traditionally quite scattered across different disciplinary boundaries. And most studies have concentrated on the meaningful, the needs assessment, if I say, rather than on implementation or impact or cost effectiveness. And that has an impact on policymakers and practitioners or the government ministries in relation to what programs to prioritize and how to allocate limited funding that we have in our field to maximize the potential for access, quality, continuity, and coherence of education in these settings. So the special issue that we are bringing to you actually is an effort to bring together the evidence that is across different disciplines. And we have actually brought together 13 rigorous reviews of evidence across various topics. And also, we are aware that there is a lot of debate around the political economy of education, critical reflection and analysis of the context where educational challenges are being faced by a whole range of different communities, and therefore we advocate as an editorial team for a multi-method and multidisciplinary approach to research. But nevertheless, we have attempted to bring together the evidence which actually focuses on what works, but also why, for whom, under what conditions, and through which mechanisms. So essentially, the attempt is to show what evidence is available and in a very synthesized manner, and to create a kind of a debate within the research, policy, and practitioner community around where we should focus for research in order to produce more evidence to support the to the EIE community, but also how to maximize the uptake of the evidence that is available with us. So today, what I am presenting here is a wonderful panel of five researchers. First of all, I'm going to start with Dr. Sylvia Granges-Ferrans, who is Education Director at IRC. And then I will then invite, let me look at my order. Manya Oriel Kegan, who is a researcher working in the field of education, conflict, and emergencies. Then we got Jonathan Koch, who is a senior education researcher with the IRC. And then we got Fergal Turner, who is Senior Education Research Evidence and Learning Advisor with Save the Children UK. And then finally, we've got Amal Hayat, who is a researcher and innovation specialist at EdTech Hub. So we're going to go in that order, and then I've requested the presenters to speak about 7 minutes, and I'm going to be very strict with time so that we have about 20 minutes available at the end of the presentations for a Q&A. So without any further ado, can I invite Sylvia to start her presentation?
Thank you, Tejendra. Thank you so much. Thank you to also my co-editors, Tejendra and Gray, who and all the contributors that made the special issue possible. The paper I'm presenting is titled Sequencing Fit for Purpose Research for Greater Impact, Value for Money and Sustainability, a Phased Methods Approach for Conflict and Crisis Settings, which is a paper that I developed with IRC colleagues, Marie-France Guimont, who is the program director of ERIC, and Jeannie Anand, the CEO of the IRC Cerebral Impact Lab. The paper emerged from several years of work at the Cerebral Impact Lab, which is the innovation and research unit of the International Rescue Committee, and also a lot of collaboration and work as in the ERIC program, the Education, Research, Conflict and Protracted Crisis, as well as from many conversations with researchers and practitioners, donors, policymakers who are all grappling with the same questions. How do we generate research that is actually useful for improving education systems in conflict and crisis settings? If you go to the next slide. Over the last decade, education research in humanitarian settings has expanded significantly. We now have many more impact evaluations and systematic reviews than before. We even have the first meta-analysis in the field that the ERIC program also produced for literacy, numeracy, and social emotional learning, and which are also being published soon in other journals. And however, despite this growth, there is still a disconnect between the kinds of evidence that we produce and the kinds of evidence that decision makers actually need to design, implement, and scale and sustain effective solutions to the education problems that exist in humanitarian settings. Very often, the research that we produce either stops at identifying problems or jumps too quickly into evaluating impact without adequately understanding implementation issues, feasibility, political realities, or sustainability. So this particular paper responds to that challenge because we're introducing what we call the ERIC-phased research methods approach, which at its core argues that different stages of intervention development require different types of evidence and different types of research methods. So rather than treating all research as interchangeable, we propose that there needs to be a sequence approach to evidence generation that aligns research methods with the maturity of the evidence that exists in the field and the stage of the intervention development. So the method includes 5 broad phases, which you can see here. The first phase is to try to understand the problem. In conflict and crisis settings, we still, in many places, still lack basic information about who is excluded from education, why learning outcomes remain low, how conflict shapes educational trajectories. So in this phase, we try to conduct needs assessments or formative research to understand the barriers, the contextual realities, and the community perspectives. So we argue that this research should be locally grounded and participatory and should not be externally imposed at this level of the research. The second phase of that is once we understand what are the problems, we need to design solutions. So we need research that helps us develop interventions that are feasible, desirable, and relevant for the communities that the research is meant to serve and that the interventions are meant to serve. So in this phase, we suggest to draw heavily on human-centered design, behavioral science, and co-creation approaches. And one of our central arguments in the paper is that interventions are far more likely to succeed when local actors are involved not only in the implementation, but in defining the problems and shaping the solutions from the beginning. Okay. So once we have designed solutions and co-created those solutions where the local actors are in the driving seat, then we want to conduct implementation research or what sometimes we call piloting. So in this phase, we ask, how does an intervention actually work in practice? Because in humanitarian settings, even strong program designs can fail due to weak implementation. Teacher turnover, insecurity, low attendance, fragmented systems, all of these realities can shape the delivery. So implementation research helps us to distinguish between intervention failure and implementation failure. It examines quality, fidelity, uptake, and operational feasibility before we move to large-scale effectiveness testing. So once we have proven that some intervention is being implemented as intended, that's when we move to the fourth phase, which is effectiveness research. This is a phase that many are familiar with because it's highly prioritized by donors, but it's the phase that typically there's impact evaluations, there are randomized controlled trials, quasi-experimental studies, and sometimes, if there's enough evidence, systematic reviews or meta-analysis. All these methods help us to understand whether the interventions have a causal effect and actually lead to improvements in outcomes such as literacy, numeracy, social emotional learning, well-being, mental health. In this paper, we say one of the key messages of the paper is that impact evaluations should really not come early. Interventions that have not been adequately designed or implemented with quality should not be evaluated for impact because the effectiveness research at this stage may produce misleading or null findings that tell us little about the intervention's actual potential. And finally, the fifth phase is scaling and sustaining interventions. This is perhaps one of the areas where the field has invested the least. We often pilot promising interventions, but there's fewer studies examining how programs can actually be integrated into education systems, financed sustainably, or maintained over time. So the framework emphasizes that scale and sustainability should not be conducted at the end of the phases, but they should be embedded from the beginning and from the stage of formative research. And so to this end, we also highlight their cross-cutting dimensions that are often neglected. The first one is political economy analysis, where we try to understand the incentives, the power dynamics, governance structures, and why systems function the way we do, to understand whether these interventions are going to be able to be scaled up and sustained. The second also is costing studies and value for money analysis, because in resource-constrained settings, such as humanitarian settings, we really need to understand not only that something works, but at what cost, to understand whether something is affordable and scalable. And the third measurement is measurement research to ensure that the tools are actually valid, reliable, and contextually appropriate. If you move to the next slide, one of the things that we did in the paper is apply the framework to map existing evidence. So we mapped 550 high-quality studies conducted in the field between 2000 and 2024, and we found something that is really striking. The vast majority of the studies focus on formative research and identifying the problems, but there's far fewer studies on intervention design, implementation research, political economy analysis, measurement, or costing. And so we're very good at documenting challenges. We're very less effective at generating actionable evidence about how to build, adapt, sustain, and scale solutions. And this really matters. So and we also mentioned that skipping phases also has consequences. If we move directly from identifying problems to conducting impact evaluations without investing in design research or implementation learning, we're risk producing interventions that are poorly aligned with local realities, difficult to implement, or impossible to sustain. So overall, the paper is not arguing that every project must follow a linear sequence because conflict settings are dynamic and messy, but that instead the research process should be iterative, and that the research questions that we ask should really match the actual stage of the evidence in each of these settings. Finally, we argue that evidence generation is not neutral. The decisions about which knowledge count, which outcomes are measured, which costing is considered, and how political constraints are analyzed, they all shape which interventions become visible, legitimate, fundable, and scalable. So we really are hoping with this paper, and I'm concluding now, that the framework can be used to structure research agendas in humanitarian education, not simply asking whether programs work, but also asking how research itself can better support durable system-level change for children affected in conflict and crisis settings. Thanks, Tejendra.
Great. Thank you, Sylvia. Much appreciated. So without any delay, can I invite Amanya for her presentation? You're on mute.
Can you see the slides and can you hear me?
Yes.
Perfect.
Yeah.
Okay.
Please go ahead. Yeah.
Okay. So I wanted to present our article with Camilla Fabry that looked at evidence-based interventions, focusing on schools specifically, and it's with the support of all the ones mentioned here in the slide. So why did we choose this topic? So In context of conflict, of course, and crisis, safety is one of the major concerns, right? Of course, for the children. And schools are seen as these places, these safe havens, or places where children can receive care and learning. And of course, many interventions are focused on schools, and it's a major kind of space for change. But violence, unfortunately, can also seep into schools, and schools are often targeted, and can also act as hotspots of radicalization. And in context of crisis and conflict, violence against children, of course, is also often normalized, both from different adults, including teachers and peers. So we really wanted to figure out what actually works in helping children remain safe in schools in these contexts. So what we did a literature review of both gray and academic literature, using 100 keywords that relate to these topics in any way, and we found 600 studies. But actually, after excluding studies that didn't focus on schools or weren't in these contexts or did not use designed as a RCT or quasi-experimental designs, we actually only found 17 studies that were relevant. And these are just the studies and where they were located. But what I wanted to show you that was most of the studies focused either on cognitive behavioral therapy or mental health. But while these are really, really important, what we often didn't see, or these studies didn't show, was that mental support, while very important for well-being, does not always seem to affect social functioning or actually reducing violence in those contexts. Similarly, also to social emotional learning interventions, we didn't always, the studies didn't always look at how these affected reduction in peer violence or how children perceive their safety within these contexts. And a third intervention that we saw as quite impactful was child awareness, or schemes in which children could report violence and try to create change. But this requires the participation of different bodies, right? Not just the teachers and the schools, but also social workers or different bodies that could actually look how this is addressed, how these issues are addressed in school context. So first of all, what I wanted to highlight was that these studies and interventions in these contexts, while extremely important, are very few. Safety is often seen as an enabler for better school climate, but not actually consider how the lack of safety in schools also creates a barrier to participation for many children to be in those schools, which are in those cases promoting violence for children or include violence for children. And we really need to better understand the links that may be, while intuitive, between prosocial behavior, social and emotional learning, and perception of safety, how that actually impacts cases of violence against children. Another major issue is, of course, accessibility. Children who are displaced or with disabilities, and also girls, often are excluded from schools and experience higher levels of violence. This is an area that we need to understand more about. And successful violence reduction are also really require a multi-layered, holistic, and complex approach. So this is some kind of key findings about the interventions themselves, but I also wanted to highlight as kind of a sector, humanitarian sector, and what is the gap in evidence. So first of all, many of the studies, while focusing on interventions, don't really as kind of Sylvia mentioned before, we really need to understand how this can be replicated. What are the issues? What we need for these interventions to be implemented in a way that it's replicable and effective. There's a lack of baseline. So many times studies mention safety, but they don't actually define what that means. What is safety in schools? What is violence reduction? How do we measure effectiveness? And this makes it really hard to establish and understand both the impact of the intervention and how we can measure and compare different interventions. We really need standardized tools and protocols to measure safety, which of course are context specific, but also we do need some kind of standards and understanding that we can enrich each other's work in this and understand and promote this issue generally. And finally, the issue of cost efficiency and effectiveness of the interventions is something that across the board was not mentioned almost in the studies. And really, in order for it to be replicated in the field, we need to know more about that as well. I think I've done less than 7 minutes, but please.
That's great. Yeah, thank you so much, Manya. That was perfect. So the next presenter is Jonathan Cole.
Thank you. Good afternoon, good morning, everyone, wherever you are in the world. Today, I am presenting an evidence review on learning through play in conflict and crisis contexts, primarily focused on education interventions, conducted by myself alongside Ashley Sable and Anne Smiley. And for this, we primarily were looking at what the existing evidence on learning through play in emergencies interventions impact on education access, quality, continuity, and systems coherence, as well as on children's holistic learning outcomes and well-being. Oftentimes play has come up and there's a question about what exactly is play. And so what we did was we started with a review of learning through play interventions conducted by Gaffer and Campbell in 2021 that had a little bit of a different focus. And so we refined that, but we primarily included studies with a focus on forcibly displaced populations, included some sort of learning through play activities. So that could be guided play, games, or playful instruction. And we particularly looked at education settings, understanding that play at home and with caregivers is also important, as well as in community spaces, but we wanted to focus in primarily in education and learning settings for a total of 42 pieces of evidence. Now, for the inclusion criteria of what is learning through play, it's complicated and there's a lot more behind what exactly play is. But for us, we built off of this conceptualization from Jennifer Zosh and colleagues from 2018 of play as a spectrum. And from that, there are some different aspects of play as guided play, as games, as playful instruction. And so from that, we sort of thematically analyzed the different interventions that we saw and saw three different types of interventions. The first being learning through play as supplementary guided play in games, where that was primarily targeting specific children, and that could be applied through all phases of crisis, as well as learning through play as formal classroom pedagogy, and then learning through play as non-formal content and pedagogy. And the sample size on the right is the number of studies that we included in the review per intervention type. And in summary, in terms of our key findings related to education, access, quality, continuity, and systems coherence, we see that there are some common themes of findings that were reported across the intervention types. We saw a lot around improved teacher-student relationship, around attendance and enrollment, and around kind of more child friendliness and student-centered active teaching methods, where that kind of varied across. But generally, those were some of the strongest themes that we saw emerging as relevant and the impact of LTP interventions. And then at the child level, we saw fewer impacts, especially connecting foundational learning skills like literacy and numeracy with social emotional learning skills. We did see some with reduced PTSD, where there were a lot of school-based MHPSS and play-based interventions. And so it sort of makes sense that there's some of those reductions in PTSD. But we also saw some reductions in PTSD in some more kind of whole class, broader activities such as learning through play as formal classroom pedagogy. And we see that a lot of the improved literacy, numeracy, and academic skills comes from the first and the third intervention type of LTP supplementary guided playing games and LTP non-formal content and pedagogy. So taking it as a whole, there's a lot of promise of the value and potential impact of learning through play as an approach to supporting children's holistic learning and well-being, but there is still a nascent evidence base. And some of kind of the key implications were around 70% of the studies that we included in this review were published after 2019, indicating a growing evidence base on learning through play in emergencies based on how we defined it, which we think is, sort of commensurate with the increased growing attention towards learning through play within the EIE sector as a whole. We did also find limited quantified evidence on attendance rates, as well as limited studies analyzing both foundational learning and SEL outcomes. So especially for that first area of looking at children's access and continuity of learning, very few actually measured attendance rates. And then when it came to the child holistic learning outcomes, there were some studies that just looked at literacy and numeracy, some studies that just looked at SEL and MHPSS outcomes, but very few looked at both and sort of saw them comprehensively. So identifying some of that gap. And then the last that I sort of alluded to was that LTP as a formal classroom pedagogy has the weakest evidence base. At the time of the publication, there were no impact evaluations included in this review for that particular area, whereas LTP as non-formal content and pedagogy had a meta-analysis. So more evidence is needed on LTP as formal classroom pedagogy to sort of compare across these different LTPI intervention models, which ones really seem the most promising and in what context and what purposes are they really fit. And so for that, a comprehensive and coordinated research agenda is needed with a range of methodologies and from a range of contexts, including cost research, including longitudinal research. All of those were sort of identified as gaps. Thank you.
Perfect. That's exactly on time. Thank you, John. So now the next presenter is Fergal Turner. Over to you, Fergal.
And I hope I can do the other speakers proud and continue to be on time and not behind. So let me just share my screen started. So the paper that we contributed relates to the catch-up clubs approach, which is an approach that Save the Children has been developing based on the teaching at the right level methodology since 2020, initially as a response to learning loss because of school closures during COVID, and more recently expanded across a range of humanitarian, but also non-humanitarian contexts. And specifically, our paper was a response to this paragraph, which I've included here, which was in the original call for proposals, which frames the risk of a focus on technical solutions as ignoring or insufficiently considering political economy dynamics, deeply rooted structural inequalities, and incoherence in education systems. And so this made us think, where is that balance? How do you first balance the need to have viable technical solutions which are replicable, which can be deployed quickly, while not falling into this trap, while not ignoring these dynamics? And what does this look like in practice when you get it right? And so when we were thinking through this, we thought about using Kingdon's multiple streams approach as our theoretical framework. And the MSA frames the technical solutions as being a policy solution, but they need to be wrapped within an understanding of the politics of implementation, as well as a shared recognition of problems. So to put it simply, not only are you doing the right thing, but are you addressing the right problems, and are you doing it in a way that is politically coherent and politically viable? Oh, I've stopped sharing my screen. Is that right? No, you can still see it. Sorry, it just came up with a message. So our results, what did we learn? So our first part of this was to do a review of evaluations which we already had of catch-up clubs. So this focused on designs that were either experimental or quasi-experimental and looked across 5 conflict-affected contexts in which catch-up clubs had been used as a solution. And from that, we saw strong positive effects on literacy and numeracy outcomes, with some sporadic but promising evidence on socio-emotional learning. The data we had on the equity of these outcomes was weaker, as was evidence on cost effectiveness. But taken together, we saw this as being evidence of catch-up clubs as a viable policy solution, in that they have the potential across a range of contexts to improve learning outcomes and therefore address the identified problem of learning loss. But then to look at how this works in practice and how this addresses the politics and problem strands, we had a deep dive case study of catch-up clubs in Colombia. And what you see, I think, is really interesting. When you really dig into what happens in practice, you see how this question of shared identification of problems and shared understanding of political dynamics is navigated and negotiated in practice by teams on the ground in ways that really aren't captured in our literature and in our technical manuals and in our guidance on technical approaches, but that are deeply embedded in teams' ways of working, their understanding of political context and political economy, and their ability to work with communities and with partners to identify these problems. And I think that is a really good example of what a policy solution looks like in the practice of implementation. And I think it gives us really strong cause to reflect on what it is we mean by a solution, that there is really no such thing as an off-the-shelf solution that can be implemented, because it will always be implemented by people, by teams working in collaboration. And I think if we are serious about using solutions to address local challenges, we need to find ways to enshrine, to formalize, and to better understand those complex processes of going from the policy strand, as it was the solution strand, into a more balanced understanding of both problem and politics. And so I think that kind of brings us, and the question that was framed to us as speakers, where does that lead us? What is not known? And I think that kind of like implementation research, and it goes back to Sylvia, what you were saying about those stages of research, that scale up research of not just do you know a solution works in one context or across a number of contexts, but what does that process of scaling, replicating, rolling out solutions look like? And how can you use that evidence to build stronger manuals, stronger approaches, stronger teams that can identify those problems and navigate those politics in ways that are locally adapted and relevant for the systems in which you're working. That was less than 7 minutes, I believe. So on to the next speaker. But yeah, really interested to hear questions, thoughts, challenges, either within this meeting, or please do reach out by email.
Excellent. Thanks, Fergal. The final presenter is Amal Hayat. Over to you, Amal.
Thank you, Tejentra. I'm just going to share my screen. I hope it's visible to everyone.
Coming up.
Hi, everyone. I'll be presenting insights from our evidence review on remote teaching and learning during emergencies on behalf of my colleagues from EdTech Hub. And just a brief overview of what we do at EdTech Hub. We work towards providing clear evidence around the use of education technology to decision makers, primarily in low and middle income contexts, with one of our focus areas being education in emergencies. And so when we talk about education in emergencies, especially since COVID-19, which was the first sort of test of how technology can be used in large-scale emergencies, we found that there has been an increasing focus on using EdTech as one possible way to continue education. But what usually practitioners in particular and policymakers tend to focus on a lot is the technology aspects of educational technology as opposed to the educational elements of it. So they're more focused on what EdTech can be used immediately. So what platforms, what programs can be used as opposed to how EdTech can be used. And so for one of our evidence reviews earlier, we explored programs, platforms, and different designs around the use of education technology in emergencies. But for this piece, we wanted to focus more on the how EdTech is used elements of it. So we found that there was a significant gap on research on remote pedagogies, on how technology can actually be used in remote education and during emergencies, so highlighting a very critical and crucial gap. And so we wanted to explore that area a bit more and wanted to answer this question really around what does global evidence exist and what does it tell us about promising practices in teaching when we're supporting students in remote education. And here, just to add, remote education is primarily taking the UNICEF and EdTech Hub's definition of remote education, where teachers and students are not physically present in the same classroom. And so to that end, we did a systematic overview of academic and grey literature over the past 15 years or so, between 2010 and 2025. With the keywords usually including some measure of remote learning, distance education, emergencies, protracted crisis, and so forth. And remote education could be either in whole or in part, or having just a significant component. We screened initially over 610 abstracts on and including elements from snowball sampling. But what we really ended up with, given the dearth of information and research available, was only 50 resources of our thematic analysis. Unsurprisingly, given the period of time that we're dealing with over the past 15 years, a lot of information and research came out during the COVID-19 pandemic. So it's overrepresented data. Over 41 sources out of 50 included some measure of COVID-19 pandemic and catered more to high and high income contexts as opposed to low and middle income countries. Of 37 primary resources, only about 5 were quantitative methods, 3 were RCT. So there was an overabundance of mixed method research and qualitative research. And some of the quantitative methods also included self-reported data. And so therefore it has to be taken with a different sort of a lens. And some of the key insights that we found was that, unsurprisingly, a lot of what is promising practices in face-to-face instruction also carries over to remote pedagogies. It's not necessarily that different. It's just the element of additional challenges come under education, whether remote emergencies and remote education, particularly around the use of technology with limited digital skills that teachers have, around the social or lack thereof of social interactions between students and teachers. And so, unsurprisingly, the human element comes out very, very strongly in most of the evidence that we've reviewed, be it in the form of teacher presence, which is doubly important given the context of emergencies, where they become supporters and providers as well for psychosocial well-being for students, as well as catering to their instructional needs. Peer interactions were also very, very crucial, again, with supporting students' emotional well-being. Caregiver participation, in particular for primary students, was highlighted as significant, given that the facilitation element is required for using technology in that context. Feedback loops between teachers and students and teachers was very critical, both for engagement and student engagement, and as well as for tailoring and adapting the teaching methods to a remote emergency context. And so, unsurprisingly, the same sort of things that would consider valid in face-to-face instruction do not carry over to emergency remote instruction. So they require a significant adaptation at the teacher's end, at the content end as well, which includes tailoring and reducing the amount of core content, reducing the volume of it, putting students' well-beings and needs first before actual curriculum. Clear communication and protocols become very, very significant since information dissemination is very, very critical. There's also a difference between asynchronous and synchronous approaches is not very, very clear in that there's no measurable link between learning outcomes and difference between asynchronous and synchronous approaches. But there's some nuance to it, with sources suggesting that younger students would benefit more from flexible and asynchronous approaches as opposed to older students who would benefit more from structured live sessions. Given how crucial an element teachers play in remote education, teachers lacked support for remote pedagogies, particularly in low and middle income contexts during COVID-19, which highlighted the need for tailoring the continuous professional development opportunities for teachers in relation to their expanded expectations, including psychological first aid. Communities of practice, particularly digital communities of practice, were found to be very significant for knowledge sharing among teachers, as well as acting as social and emotional support. And so, given some of the research and policy implications, especially given the context that we work a lot with policymakers and practitioners, is that it's very, very critical to adopt a pedagogy-first approach that centers teachers and learners' well-being above all else, because usually what we see is technology always takes center stage, where teacher and student well-being is relegated to the backseat. So technology can facilitate, but cannot replace teachers, and pedagogy must also be tailored for context. Future research, since COVID-19 data was overrepresented, future research should focus more on an expanded idea of what emergencies and crises can mean, particularly since the way that we define emergencies can vary significantly. So we've also highlighted that there is a limitation with this research, that given the way that we define emergencies and protracted crises, there might be elements that we missed out on simply because they were defined somewhat differently. So we need an expanded terminology and skill set. As well as including more quantitative and evaluating more findings in relation to learning outcomes and tying that pedagogy to learning outcomes, which we didn't see much of in this review. As well as addressing the teacher support gap to enable remote instruction more effectively, as well as building on promising research from LMICs, which within the context of COVID-19 was underrepresented since the higher income contexts were much more of a focus area. And in general, just like one last key takeaway for policymakers specifically and practitioners is that investing in pedagogy and people first is much more crucial for adaptive resilient systems in the context of emergencies, because they are very much reliant on human relationships, with technology only being a facilitator. Thank you.
Great, excellent. Thank you, Amal, and thanks everyone. That was fantastic. So we just finished on time as we planned, and we got 20 minutes for Q&A. Just to kind of a couple of questions to the panel from me before we invite participants to share their questions as they will begin to come in, I suppose. First of all, the nature of systematic reviews is that you have to follow an exclusion and an inclusion criteria, right? And in our field, we know that research takes place in really complex and challenging settings. And also a lot of local researchers who don't have the resources to conduct rigorous, high-level and methodologically supposedly rigorous in sort of academic terms research in those settings. They are at risk of being excluded from the review that the systematic reviews, conduct. Could you reflect on how do we not miss out on that promising evidence that might exist in those publications which may not meet the criteria that the systematic reviewers set out? So that's my first question to the panel. The second question is, I think we've done this great job like synthesizing a huge amount of research that has existed in various areas in our EIE field. But how do we actually engage with policymakers, practitioners, and those decision makers that we have the evidence now? Because I often personally get frustrated by the fact that we put so much effort into writing up research and publishing them in research in journal articles, then we continuously argue that research needs to be taken up by those who are involved in policy and practice. But what do you think is our responsibility now? What would you do personally to sort of socialize the practitioners and policymakers that you've intended for with your research findings? The last question is for Sylvia from me. I think the research, the phased method approach, I think is quite exciting, I think, as a research to have a look at. It just puts you in a really nice frame in terms of how research should be conducted. But what do you think is the strategy for adaptation of this particular framework? Because there are individual researchers, doctoral researchers, or individual consultants and doctoral researchers, but also research consortiums. But then especially in this times of limited funding in our field, how do you prioritize where to focus on? And how do you actually justify the particular stage of the framework is the right phase or right stage for that particular topic or for that particular intervention? Could you tell a little bit more about how should we actually move forward with this very nicely prepared and presented framework? So, with the first two questions, anyone, then maybe after that, Sylvia could respond to her question.
I mean, I can as well share some thoughts on the first on the how not to miss on the local knowledge,
Sure.
right?
Go.
And so I think the first thing is that, I mean, no matter what, I think it's very important that all systematic reviews or meta-analysis or any type of effort that is trying to synthesize the evidence would, like acknowledge what are the limitations and be really, really explicit about what is included versus excluded and why, because there will always be limitations, okay? But there are also ways to ensure that some of the local knowledge is included. Like, for example, one of the things is that to really go beyond the like academic databases, to try to, if possible, and these days is easier with AI to use multilingual search strategies so that it's not only things that let's say that are in English. When possible, of course, this requires resources and things, but when possible, to try to include local researchers that will also include conduct local searches, and that will and sometimes that the if possible, again, all of this requires resources, but that the inclusion criteria or that the searches is not only by keywords, but that, for example, you can also conduct searches in local organizations within the context that you are. So go and look at the websites of the local organizations where some of the evidence may be housed. Like, for example, in some recent meta-analysis that we did, also the IRC and with support from the ERIC program. Yes, going beyond the databases and trying to look at the websites that are relevant for example, in specific, if you are doing research in specific countries, going to the university sites, the professors, the researchers, and as well as trying to potentially reconsider the quality criteria that may unintentionally leave some important research out, but that is really defined by researchers according to like the scope. And there will always be a scope and limitations, but this is, in any setting that is possible, trying to also include any participatory validation processes that could, as well ensure that the evidence included is okay. Just some thoughts, yeah.
Okay, great. Thank you.
I think I can answer your second question. If I understand correctly, it was on sensitizing policymakers to the research that is coming out.
Yes.
I would say that in our experience with EDECA, we both generate evidence and then communicate said evidence to policymakers. And it's a very slow and time-taking process. It happens over years and not even just like one research is not going to do that certain task. It's a lot of that, what that means really is doing a synthesis of research, translating that and just like inputting that with policymakers bed by bed and establishing an ecosystem essentially and having very, very close relationships. Particularly what worked for us at EDECA is that our close relationships with ministries of education through political upheavals have really supported the evidence uptick. And it's a very slow and laborious process, but it takes the time and a very strong system to back it up over a period of years, if not decades.
Right. Thank you. Manya?
Yeah. So I think, first of all, I think there is a lot of research on safety as kind of a part of different elements of what happens in schools in education emergency context. I think what maybe is missing is a bit of really using it as one of the indicators. Whenever there's an intervention that mentions safety as an outcome of the theory of change, it often fails to think, to actually account for incidents of violence, so things like that. So I'm thinking in what Sylvia mentioned, kind of the 5 steps of research, this is really, a lot of it is not a failure, but there's an issue in kind of the design stage of interventions. So really thinking about co-creating ways that, what do we think about safety? Where do we want to see ourselves in several years in that school, in this context? Consider what safety means in that context particularly, and then trying to identify changes. Because the interventions, focusing on well-being and social emotional learning, see this as kind of a natural kind of result that would kind of naturally occur, which may be the case, but we don't know. So I think I would think that there's an issue about the design stage, and I wonder also if we can co-create these things, then maybe that could also help engage with policymakers. And I do want to say that I am a qualitative researcher generally, so I do look more at like the other studies that aren't captured in these studies. And I do think there's a lot we can learn from them, but we do lack the translation of what, case studies with, 20 participants somewhere in a project that was a pilot, low budgeted project rarely translates into something that is then, financed as an RCT project that's rolled out in different contexts. And that is an issue, right? Kind of across the board, maybe that we can think of, a format that we can all use or a database where we can all see what things have occurred and try to engage with that and not always try to reinvent the wheel. Yeah.
Yeah, great. Thank you. Fergal or John?
Yeah. Oh, go ahead.
I was just going to come in, and I can see that kind of discussion on the policy relevance also links a little bit with Susan's questions popped up in the Q&A around cost effectiveness. And I think sometimes, our research can be too internal looking. If you think of the kind of incentive structure around what drives evaluations, the questions are being asked are not always the questions which are most relevant for people who need to make decisions about these things. And so if you take the question of cost effectiveness, cost effectiveness is really important, but it doesn't tell you anything about affordability or scalability. And so I think that a lot of the discussions we've been having around actually how do we synthesize better data, not on cost effectiveness, but also on costing and cost to scale. For example, what of the cost if you were to replicate a program at scale, or if it was to be institutionalized within a government system, what would those costs look like? How would they change? And will that actually fit within government budgets? And so I think that's kind of an example of, I suppose, where the incentive structures or where the motivation structures around how and why we do research don't always align with the kinds of questions that are being asked by policymakers. And I think that goes back to the point of we were trying to make in our paper around an understanding of the problem. And sometimes the problem is not what works, but the problem is how can we make what works work within the specific limitations that we are faced with.
It's a very good point. Thank you, Fergal. John?
Yeah, I was also going to add on to what Amal was saying in terms of the policy practice gap and thinking about a couple things with, having the evidence, but the benefits of, I think, especially ECR is like open access and short and like easy and digestible. And I think, Amal also mentioned sort of needing to synthesize the synthesis, but I think some of that connection to getting rigorous evidence reviews be outside of sort of capital A academia into kind of broader discourse and allowing kind of more engagement in sort of those long-term processes that do take a lot of time. And I think the other thing is like the practice side too, right? Like practice-wise, we sort of know a lot already, and yet sometimes there's a lot of that sort of resistance towards like reinventing the wheel. And I think that's where organizations or bodies, convening bodies like EiEPC, et cetera, have such promise towards being spaces for the evidence to be shared and then having more engagement across organizationally so that practitioners aren't just repeating the same mistakes, but like can actually benefit from what others are learning. And so I think continuing to dive into some of those coordination bodies is critical.
Great. Yeah, thanks very much. So I think there are a couple of interesting questions that I wanted to just highlight here before Sylvia responds to my question. So Susan Nicolai's point is about I think the cost effectiveness, which Fergal responded to a little bit, but feel free to respond, Sylvia, across the different issues explored. Where and how much data did you find on cost effectiveness and where? So others can also comment on that. And the other question is around RCT. As Susan's question was relating to, there's lack of RCTs in our field, and we need RCTs to demonstrate evidence on what works to be able to justify funding when everybody is fighting for limited funding. So how do we tackle with that? But also another comment here is around this ethical dilemma around conducting RCTs in conflict and crisis settings, where learners and teachers are in extremely difficult situations, which actually raises ethical questions. So we got about 6 minutes. Sylvia, if you could respond all of those in 3 to 4 minutes, that would be great.
Thank you. I actually don't see the questions on the side, the questions that are coming in. So sorry. But I guess on when the evidence is available on costing, we added that. I know that, for example, there's another paper on what works to improve early childhood education. So you will, Susan, there is evidence then on cost, on the cost and the cost effectiveness of those programs. Separately, the ERIC program is also producing the meta-analysis talking about the cost of what works to improve literacy, numeracy, social emotional learning, and also the cost of interventions, just cost, not cost effectiveness. They're all coming on different journals. But in addition to that, when the information is available, the people added the information on cost, and that for sure in another paper I wrote here on cost effectiveness on early childhood education, you can check it out. You have their information on cost effectiveness. On your question, Tejendra, I think that's really a very important question, and it's really important to understand that the choice of what research phase, I don't know what type of research, what is the purpose of the right phase or stage for a particular topic of intervention. It really needs to be driven by the state of the evidence and the maturity of specific interventions instead of, like, for example, what is the donor preference or methodological trends. And so it's important to really ask, and this is the invitation of the framework to ask, like, what is the key uncertainty that we need to resolve before moving forward responsibly? And so an easy way to think about this is like if you go to a place and you really need to, what type of evidence to build this? If you don't yet understand what is the problem, well, the priority should be formative research. That's it. But if there's enough evidence on what is the problem and what are the associated factors, then you need to look at whether there are actually feasible and culturally relevant solutions that are in place. And if those are in place, great. But if those are not in place, if there's not yet a feasible or culturally relevant solution, the priority should be design research to design the solutions. Okay, but if there is a solution, a promising intervention already in place, then it's important to really look at whether there's evidence that is being delivered with quality and fidelity, and therefore the priority should be conducting implementation research and to understand, is this really there's good uptake? Is it delivered as intended? If that type of, but then if you go to that same and you understand that actually there is evidence that there's a solution that is mature, is stable, is implemented as intended, but we don't know yet whether the intervention works and is it actually improving the learning outcomes or the well-being outcomes or what access any outcome that is, then if that is not in place, that is when you move to effectiveness research and conduct an RCT or some quasi-experimental study. But if you go and as well find that there are interventions that there's rigorous evidence that it works, that is they are cost effective, but then we may not have information on whether the system can actually sustain it, finance it, whether it's there's the scale it, then the focus should really at that point also be on scale up and sustainability research, including, which I mentioned, this is not something that should happen at the end, but throughout from the beginning, including conducting political economy analysis and costing analysis to see whether something is actually affordable and can be scaled up. And so overall, it's really trying to understand whether to identify what phase is really to try to understand what is the main evidence gap. Sometimes there are settings where there's many evidence gaps, but then what is the biggest implementation or policy uncertainty or priority, and be very aware on what would be the risk of moving prematurely to a phase without having solved the issues of whether something is actually addressing a local need or designed in ways that are culturally appropriate or implemented as intended, or actually whether it works. So yeah.
Yeah. Now, the second question that I also mentioned about was the RCT. So the donors want RCT-based evidence to justify or to allocate funding, if you like, or you use effectiveness research to ask for funding, whereas there's a lack of RCTs in our field. So what are your thoughts on how we maximize that? But the related to that question is around the ethics of conducting RCTs in conflict and crisis settings. Do you want to comment a little bit on that?
Um, I mean, I think it is also important to work it is important, and one of the reasons why I think this paper can also help us with that issue is that donors may want RCTs, and I think RCTs are extremely valuable. And they're very important because they can help us identify whether an intervention works and it's actually changing outcomes. So those are really relevant. But but I think it's important to push back on donors when they want an RCT and the relevant evidence is not there, where an intervention is not mature enough for an RCT. I think it's important to really ensure and to also work with donors and educate donors and push back on donors so that there is enough evidence in place to co-design solutions, not to import something immediately and evaluate it. We've been in situations like that where something has not been co-designed or localized properly, has not been evaluated for implementation, and then people jump prematurely. So it is important to push back. I think one of the reasons we put this paper out, is to ensure that that there is a proper sequence of things before RCT. I see, Susan, you say also on the chat the academic rigor of RCTs, but they raise ethical dilemmas on the ground. There are many situations in which RCT can, of course, raise ethical dilemmas on the ground, but there are as well many uh, uh, mm, opportunities to conduct RCTs in very ethical ways, because the reality is, and it's something that, for example, we see all the time, the reality is that there is, I mean, I think sometimes it's more unethical to try to continue funding interventions that don't work. And so I think it's important to evaluate whether they work. And we have evidence, and we just produce meta-analysis, for example, where in the field of social emotional learning, a lot of people care about SEL. It's like everybody wants to support it, and there is not one single individual study that shows impact on social emotional learning outcomes. And so people can continue funding programs, but if they don't actually change outcomes, then maybe we need to rethink our approaches. These help to understand whether something is working or not. And there are many ways to do it in ethical ways, because it is often the fact that there's a lot more people needing an intervention than funding available, and so that allows for an ethical comparison of those receiving treatment versus those that maybe need to wait for a future wave of data collection. But
Mhm.
yeah.
No, thank you, Sylvia. I think that was a very helpful response from you. I think in this special issue, even though this is a sort of rigorous review of evidence, and we've tried to synthesize evidence across all of these papers, we definitely have advocated for multi-method, multi-approach, and multidisciplinary ways of knowing about, how things are, not only how things work, but also how things matter in those settings, and how certain types of educational practices are valued by teachers and communities. I think education is a hugely relational endeavor rather than a sort of measurable sort of delivery here that I would personally argue. So in that sense, I think RCTs are useful, but also they are not the ultimate solution or answer to all the problems. And I would like to echo what Sylvia said, that we also need to socialize with donors and educate and sensitize donor community, that the source of evidence can be all sorts of methodological approaches, not just on RCTs. I'm afraid we've run out of time, and I just want to say a huge thank you to Gray Reinhardt, who is also a co-editor, and of course Sylvia Grandos Ferrans, for amazing work that the colleagues have put into making this special issue possible. And of course, our huge thanks goes to all the authors who have put their effort into bringing these papers to the publication, but not to forget the reviewers who have contributed by providing critical feedback to bring these academic papers to these standards. And thank you for joining this webinar today, and really appreciate it. And we've shared the links for the whole issue of this the ECR, as well as the links for the individual papers. Please do get in touch with the authors, with ourselves, and do come along in our future webinars. And I wish you all the best for the rest of the day and rest of the week. Thank you. Goodbye.